Thank you so much for joining us today to hear about the HIIN results and next steps post-HIIN. During today's webinar, you're going to be hearing from 4 state hospital associations who led the efforts in those states for the HIINs, and we'll also be sharing the tremendous results that have been achieved by participating hospitals. We're really excited to share this information today, and we're so grateful that you've joined us. And so we're going to shift gears after you hear about those results, and we will hear more about what's next and new information coming out about our partnership with Superior Health Quality Alliance and what's coming down the pike. So first, we're going to kick it off by passing it off to the Illinois Hospital Association. So Jenny?
Hi, everyone. My name is Jenny Winkler, Director of Quality, Safety, and Health Policy at the Illinois Health and Hospital Association. So I want to kick things off by sharing a couple of our successes with you through this work. So the first success I want to share is around the ALTO project. So the GLPP ALTO project was an initiative to expand on the success of Colorado's opioid safety project. And so participating emergency departments implemented pain management protocols with the goal of reducing the administration of opioids while treating pain with the use of alternatives to opioids. So as a result of this work, in the Illinois emergency departments that participated in the first cohort of the ALTO project, we've seen a 21% reduction in the amount of opioids prescribed and a 13% increase in the ALTOs administered. Currently, there's a second cohort of our ALTO project ongoing, and we'll be collecting data through the third quarter of 2020. Second success I really want to share with you is around our Project ECHO work. So the IHA team partnered with Southern Illinois University School of Medicine as part of 2 ECHO hubs. Our first hub focused on the treatment of resistant hypertension in rural or underserved communities. And outcomes from that hub included the training of 92 providers from 18 organizations across our state. All of our participants reported changes in the management of hypertension patients and found that participating in our ECHO program really supported their work with additional best practices. Our second hub focused on improving access to care for opioid use disorder patients by training ex-waiver for physicians across the state on the delivery of medication-assisted treatment services. And outcomes from that hub included the training of 147 physicians from 24 organizations across the state. And these trainings mainly occurred in central and southern Illinois, which are areas of our state that are MAT deserts. Our third success is around our enhancing partnership work, where we teamed up with a statewide network of community-based organizations that provide care coordination and transition of care support for at-risk populations. So through this partnership, we worked with cohorts of hospitals and different community-based organizations really to increase the knowledge about the underutilized services of community partners, identifying specific social determinants of health needs across the communities, discussing referral processes between hospitals and community organizations, and identifying opportunities to really improve transitions of care for our patients when they're discharged from the hospital. So we've worked with different facilities in a matter of ways, including one-on-one coaching, working through hospital systems and their local community organizations, as well as facilitating one-day workshops for hospitals and their community partners to come together. Through this work, we've connected 41 hospitals with 28 different community-based organizations to address social determinants of health and enhance the referral process between those organizations. The last success I want to just comment on is the development of implementation playbooks. So as part of our HIIN work, we worked with hospitals and community partners to identify best practices or innovative approaches to help us achieve our HIIN goals of reduction. And so through those best practices, we created these implementation playbooks, and those are digital resources to support hospitals and community organizations with implementing those same approaches and allowing us to spread our best practices across the region. So our aim with these was to create a resource that was a different look and feel than a typical toolkit. So we wanted something organizations could really pick up, read, and then start working with right off the bat. Within each of our playbooks, there's sections that talk about the different innovative approaches and how to use the playbook, a little background on the development of these playbooks, and the cast of characters from each of the organizations that have actually implemented these best practices. Topics for our playbooks include the reduction of ED recidivism and unnecessary hospital admissions and readmissions, reducing C. diff infections, improving compliance with sepsis bundles, the implementation of daily safety huddles, antibiotic stewardship, enhancing the partnership between hospitals and community organizations, and the integration of social determinants of health screening in the emergency department. IHA partnered with DoTank, a business design organization, to design these playbooks and also to develop a healthcare innovation hub where these playbooks can be downloaded. So the Innovation Hub really, again, is designed to facilitate the spread of these innovative playbooks, and the link to the Innovation Hub is found on this slide. So the next slide really just is a snapshot of our improvement data from the HIIN program. And so just taking a glance at this, you can see there are definitely opportunities for us to continue to partner with our hospitals, especially in decreasing pressure injuries and reducing readmissions. But in Illinois, we've made great strides with addressing CAUTIs, CLABSIs, C. diff infections, and opioid adverse drug events with our hospitals. So at this time, I'm going to go ahead and turn it back over to you, Michelle.
Thanks so much, Jenny. And congratulations on such tremendous success in the Illinois hospitals. So I'm Michelle Norcross. I'm the Senior Director of Safety and Quality for the MHA Keystone Center. And I'm really excited to share some of our Michigan successes that have been demonstrated throughout our hospitals. I'd be remiss if I didn't share just a huge thanks and a kudos to all of our hospitals who have really dedicated their efforts in submitting data, driving meaningful improvement, and really working to make sure that care is safest for the patients that they're serving. So one of the biggest successes that we've actually seen in Michigan is around patient and family engagement implementation of strategies. So we're really excited to show these results and share with you some of the successes that we've seen in Michigan around patient and family engagement, and really just demonstrating how important it is to engage patient and family members in the care. So a couple of the highlights I wanted to call out specifically were 98.21% of our participating hospitals have implemented successfully a patient and family advisory council or have a patient advisor on their QI team. And over 86% now have a patient on their governing board. That is a huge testament to the meaningfulness of engaging patients and families in their care. So just a huge kudos on that very meaningful work. Additionally, some of our successes that we've seen is around member-driven offerings. So we have actively worked to engage our members, listen to what they want, and also making sure that it is data-driven. So we have implemented projects such as implementation consults with subject matter experts, expanding our simulations to additional topic areas, offering train-the-trainer sessions so that you can take the education from us and implement it at your own institution, as well as implementing site visits for meaningful one-on-one support that's needed. We've offered large-scale spread, which has been particularly beneficial, having a tri-state offering through the GLPP HIIN. We have been able to spread large-scale improvement efforts, such as the implementation playbooks that Jenny just spoke about, Quest sessions, the quality essential skills training, offering monthly check-ins, improvement advisory, networks, improvement sprints, and a lot of other work just to make sure that we can spread large scale the improvements and result-driven improvements that we have seen across our other states as well. Finally, our last success that we want to highlight is the GLPP HIIN dashboard. This dashboard is something that we felt was particularly meaningful because it was unblinded for all of our hospitals to be able to see one another's data, be able to compare with one another, understand what their cohorts were working on and doing, and being able to learn in a more transparent method. We really felt that this continuous feedback was meaningful to each participant and really allowed everybody to understand where we were at within our state, within the GLPP HIIN, and where our opportunities for improvement continued to need to be. We're really excited in Michigan that really the only opportunity for continued improvement, where improvement was not shown, was in pressure injuries. And as you'll see, that's a common theme across the nation due to some definitional changes. We still really believe strongly that we can continue to drive improvement in all of these topic areas. But just as a couple highlights, we have continued to drive meaningful improvement in opioids work within CAUTI and CLABSI and C. diff. And I know that a lot of hospitals continue their work in antimicrobial stewardship, and a 26.3% decrease in C. diff rates were seen across this time frame. Next, I'd like to pass it off to our partners in Minnesota to share some of their results. Joy?
Thank you, Michelle. This is Joy Ben. I'm a Quality and Process Improvement Specialist at the Minnesota Hospital Association. And today I'm going to talk to you about some of our HIIN work. Trying to move on to the next slide. Thank you. So just to highlight some of our successes over the HIIN period, we developed a navigator model and comparison report. The navigator model really helped us effectively do outreach to our member hospitals who were each assigned a navigator. When hospitals come to us for advice and we have multiple topic areas and multiple specialists, we found early on in the HIIN that it was very important that each hospital had a navigator to reach out to, and we developed that as part of our initial HIIN work to help us develop relationships with the hospitals. And then that turned into something called comparison reports, where hospitals were able to go onto the website and look graphically at how they were faring compared to other hospitals. They could sort hospitals and look at hospitals of the same size to find out how they were doing and benchmark their success against neighboring hospitals. This was an effort of transparency and also to encourage hospitals to be in connection with one another to identify somebody who might be able to help them if they're having trouble. We also put a lot of effort into educational events. We had many in-person events and webinars. Ultimately, toward the end of our HIIN, we began to live stream each of our live conferences, and this was extremely well received for those hospitals that didn't have capacity to send more than one person or didn't have financing to send somebody down for an in-person all-day event. So the live streaming of educational events was one of our most appreciated activities from our member point of view. We also fleshed out our Plan, Do, Check, Act, Celebrate model, the PDCAC model. We engaged over 500 clinicians in our topic committee work. With the help of those clinician leaders, we developed 26 roadmaps to help hospitals make improvements in many topic areas. We also participated in an Excellence Award and Good Catch Award programs. The Excellence Award was offered to hospitals by not only reporting data, but by excelling in reduction of harm areas. Our Good Catch Award program was very popular. We had a quarterly award winner for a near miss for hospitals who reported finding something that could have resulted in a harm but did not. Some of our most successful awards in this area were good catches that resulted in changes to processes so that potential harm was never going to happen again. And the next slide, please. So just to highlight some of our specific success areas, for adverse drug events, we had a good reduction in adverse drug events associated with anticoagulants and with opioids. And again, going back to our roadmap, we had developed a general medication safety roadmap, an opioid ADE prevention roadmap, and a medication reconciliation roadmap that were widely used. And these are found on our MHA Med Safety page of our website. We also excelled in patient and family engagement, developing a website with many resources. We presented some of our outcomes at the 2020 CMS Quality Conference, and we also had a very large increase in the number of our hospitals who designated a patient and family engagement leader and developed patient and family advisory councils. We also performed very well with sepsis and sepsis shock. We attribute this to having really good subject matter experts who performed in-person site visits and participated in grand rounds with hospitals who were struggling in this area. Again, we developed a sepsis roadmap, and this tool and other resources are available on our website. We also put a lot of effort into our early mobility work, which was a way to impact harms in the areas of falls, pressure injury, and delirium. We brought in some of our members who had been implementing early mobility to report out on their work on a webinar in January, and that webinar recording is available. We also have roadmaps for falls, pressure injury, and delirium. So those are some of the work and successes that we had at Minnesota. Thank you.
Great. Thanks so much, Joy, and it's fantastic to hear some of your results as well. Up next, we're going to hear from the Wisconsin Hospital Association. Turning it over to you, Annie.
Thank you, Michelle. This is Annie Allen. I'm a clinical quality improvement advisor with the Wisconsin Hospital Association. I'm very excited to share with you today some of the successes that Wisconsin hospitals obtained during the HIIN work. So one of our big successes was the quality essential skills trainings provided. As previously described, they were done across all 3 states. The ones that were held in Wisconsin, we trained over 100 hospital staff and many more physicians. This also led to quest by request at individual hospitals across the state. A Physician Quality Academy also was held as a focused training for physicians. We had 2 cohorts where over 25 providers were trained by the Chief Quality Officer, Quality Director, and our Physician Improvement Advisors with CMEs provided for attendees. Our Improvement Action Network events were held across the state in multiple topic areas like antimicrobial stewardship, sepsis, C. difficile, and readmissions. They were a huge success and consisted of mentor hospitals sharing their best practices and their playbooks and roadmaps with other hospitals, which led to improved practices across the state, lots of sharing between multiple organizations. The attendees developed 30, 60, and 90-day action plans. The action plans were scanned by Wisconsin Hospital Association staff and then used for follow-up phone calls, and then new topic areas that were provided. For example, at one of the readmissions events, hospitals asked for more of a deeper dive, and we did one for CHF readmission specifically. WHA was able to bring in numerous consultants and subject matter experts directly to the hospitals that did site visits, and then some off-site virtual support throughout the HIIN. Pat Quigley, a national expert from the Veterans Administration on falls. Mary Smith did CLABSI site visits. Kathleen Volman did pressure injury site visits. Pat Poza, VAE simulations. And of course, our very own Dr. Bobby Redwood, who did lots of great intensive work across the state in the areas of sepsis and opioids. One final success in Wisconsin was hospitals were looking for a way to measure their overall quality to use with their hospital boards and to be able to track progress of overall patient safety. So with that in mind, we came up with an HRM, high reliability measure, to include 16 measures, some of which were ADEs, CAUTI, C. difficile, CLABSI, falls, MRSA, pressure injuries, sepsis, surgical site infections, and VTE. And of course, here's Wisconsin's overall improvement data across the HIIN work. It looks very similar to the slides you saw earlier, as we worked very hard as part of the GLPP HIIN, and Wisconsin did extremely well in the areas of C. difficile, opioids, VAE, knee SSIs, CAUTI, sepsis mortality, and CLABSI. So kudos to all of you who participated in Wisconsin in the GLPP HIIN, and we look forward to supporting you in your continued quality improvement efforts.
Thanks so much, Annie, and fantastic work that was happening in Wisconsin as well. I just want to go ahead and take a moment to echo the kudos and celebrations, because there's been some really tremendous work that has happened over the past 3.5 years. And I really want to make sure that everybody understands how much hard work has been put into these efforts across all of your hospitals, and just acknowledging the tremendous effort that's been put forth, and really, again, dedicating that effort to driving improvement for safer care for patients. So finally, I'd like to take a moment and talk about what we're going to be doing next. So we have partnered with Superior Health Quality Alliance, and so I am going to pass it off to Eva Panetta, who is going to be sharing more about our Superior Health Quality Alliance. Eva?
Thank you so much, Michelle. As you already indicated and heard from Michelle, my name is Eva Panetta, and I wear dual hat as a manager at the MHA Keystone Center and the Community Coalition Improvement Advisor under Superior Health. I wanted to thank you for the opportunity to share with you all today a little bit about Superior Health, and invite you to join us as we continue the work of improving quality and safety of care for all of our residents, which builds on the wonderful work you have heard featured right here on this webinar by my colleagues. So thank you for your continued engagement and commitment to this important work. Before I introduce you to Superior Health and our goals, here's a visual to help you connect the evolution and timeline of the national quality improvement efforts you all have been engaged in. Superior Health is that next evolution of these efforts with the integration of quality improvement networks across our states. In 2018, 8 quality improvement organizations across 6 states came together to work on achieving the broad national CMS quality strategic aims, with the goal of working collaboratively to improve the quality of health and healthcare for consumers, patients, clinicians, and organizations, along with communities we serve. As you will see, our mission, vision, and values reflect these goals. On this slide, you will see a list of engaged organizations under the Superior Health umbrella. I'm sure you're very familiar with many of these organizations as you have engaged in previous quality improvement work. To set the stage, here you will see what we believe will be the rollout of national quality improvement efforts across the care settings. The first scope and focus that we will talk about today is nursing homes and community coalitions, which we are now actively engaging organizations in. But we expect to see in the future a launch of ambulatory and hospital improvement quality efforts. I wanted to mention this here today because I think it's important for you to know that there will be a synergistic approach to quality improvement efforts across care settings and a strong collaboration approach with stakeholders across the care continuum. So under Superior Health priority of scopes and areas, we hope to engage regionally 900 nursing homes and partner with 35 community coalitions across 3 states, Wisconsin, Michigan, and Minnesota, all working to achieve the CMS 5 aims through 2 priority settings and areas, nursing homes and community coalitions. For those joining us from Illinois, please note that you, under this scope of work, will be working with your existing QIN and QIO, which you have previously worked in historically. The 5 aims and priorities that we expect to see across the improvement care settings are featured right here and include improving behavioral health outcomes and decreasing opioid misuse, increasing patient safety specific to reductions of ADEs and C. diff, increasing chronic disease self-management within the identified focus areas you will see on the slide, increasing quality of care transitions through a reduction of readmissions and ED utilization, as well as improving nursing home quality. Again, under priority number 1, long-term care, we hope to engage over 900 nursing homes within Michigan, Minnesota, and Wisconsin, with the focus of those in most need of technical assistance and quality improvement, working to address key goals which connect back to the 5 CMS aims outlined earlier. The second priority area is establishing and partnering with over 35 community coalitions across 3 states who are composed of partners across the care settings, featured right here on the slide. So these include nursing homes, to hospitals, to primary care, to pharmacy, as well as community organizations that help support our residents with social and resource needs. All of these organizations will work together to address the following aims as outlined by the 5 CMS Bold aims discussed earlier. So, as we ask that you share this information with your partners in joining long-term care, we also ask you to consider joining us as a hospital and health system under the Community Coalition umbrella. So, if you are a hospital organization who's looking to engage in a community coalition, or if you have a health system who already has an established community coalition, we would love to partner and engage with you and can provide additional assistance and support you as a member of our coalition. We hope you will consider joining us as a hospital under the Community Coalition umbrella, or welcome your partners in the nursing home setting. Your participation will provide you with access to experts in the field, collaboration and sharing across state lines, a data-driven improvement support that you are familiar with under your hospital association umbrella. And as a reminder, we are one team working together under the Superior Health umbrella. Participation is at no cost to your organization. And as already noted, organizations across the care continuum are welcome to join under their first priority and scope area. So, if you are ready to join us, you can click on the links below and outlined on this slide, and we can and would welcome you to engage now. However, if you have additional questions or some concerns that you need addressed, you may also contact us at the link below, as well as that phone number, and we will provide you with additional information on how you can get engaged, what the scope and goals are, and how we can help support and collaborate with you in improving care for all. So I wanted to thank you for your time, and I hope to partner with you all on the continued improvement work of care for our residents in our state. Thank you all for joining, and we hope to continue your partnership and collaboration.